There are many drivers in markets that are moving towards clinical integration. A lot of this is dependent upon the specific market area. The primary thing that we see throughout the country is that physicians are looking at ways that they can deliver care differently in a way that's going to be beneficial to patients as well as beneficial to them economically, and that's driving clinical integration. Population health management is a relatively new field, and the concepts behind population health management are taking a group of people, better understanding their needs, and then developing different types of interventions that are going to ultimately make a difference to the individual segments of patients and then impact the group overall. When you look at population health management, there are many stages that you have to go through to develop a successful program, ranging from identifying the population and creating some type of a registry. Based upon that registry, getting different data and information about the patients, using that data and information to create different segments, and then based upon those segments, developing interventions that could be applied against those segments so that ultimately you can get an outcome that's going to be of benefit to the patients and being able to measure and monitor that outcome. There are many models that are being used throughout the country today to create clinical alignment and clinical integration. This could range from very simple models such as medical directorships. Other models include co-management agreements. There are bundled payment arrangements. There are patient-centered medical home programs. The most common model in terms of number of people in a program are the accountable care organization models. The bundled payment models have a larger number of programs, but the ACOs, the accountable care organizations, cover more people. Being able to operationalize value-based care delivery is not predicated on only one key thing. There are several things that have to take place in order to successfully implement a value-based care delivery program. These things include things such as developing a very strong cohort of clinical leaders that are able to have an impact on patient care as well as on management at all levels throughout the organization. We need to have the right infrastructure in place to be able to develop these programs, and that includes having the right information technology systems, having the right people and staff that are available, being able to negotiate the appropriate contracts to be able to monitor and measure the patients that are in these programs. It's partnering with agencies in the community to being able to deliver the care in these programs. It's changing the reporting within an organization so that we're able to look at the outcomes that are going to be important to these programs and ensure that there's appropriate measurement and incentives that are tied to those outcomes. There are many different types of ACO models, and so if you've seen one ACO, you've seen one. Many of them are trying to ultimately improve quality and reduce cost. Based upon the market and the characteristics in that market, some ACOs may be focused more upon the quality, others sometimes are focused on the cost elements of it. What you see is that there isn't one specific strategy that works for all ACOs. It's dependent upon the population that they're managing and the market environment and the type of clinical delivery that's available for those patients. There are many organizations today that are successfully managing full capitation. And from that, there's a lot of lessons learned that others should make note of. One is the focus. Most organizations that are managing full capitation successfully are focused on primarily capitation and not on fee-for-service. As such, they're able to set up the clinics and the organization structures to be focused around those patients and those patients' needs in a different way.